Closed for 3 months.
I'd wear that myself.
No, you wouldn't.
No, I wouldn't.
I'll go to my mother's and sleep all day Saturday and Sunday.
Really? Pink, so it's definitely a girl. No?
Blonde, Shayna and Anna. Together in a brand new series, The Afternoon Show. Live every weekday at 3:15 on RTE 1.
Your hair. Good afternoon, everybody.
It's 3:15, the 4th of October, and you are very welcome to our brand new show. My name is Blonde Huffy, and thank you for watching.
And we have Dr. Patrick Treacy. How are you doing?
Fine, Anna.
Okay, and Sarah, of course, the patient. Is Botox and fillers, are they popular in Ireland at the moment?
Absolutely, and believe it or not, even though a lot of people haven't heard of fillers, fillers is the most popular cosmetic aesthetic surgery procedure in the world.
Seriously?
Botox and fillers last year covered something like 2.5 billion globally.
Wow. And am I right in thinking Botox is for above the eyeline and fillers is for underneath?
Depending on one's experience, but it's probably fair from a patient's point of view, we normally use Botox in the upper face and we use fillers in the lower face.
And show me what you're going to do now.
Sure. As we get older, what happens is our face begins to fall downwards. And
Sarah's hasn't fallen too much,
not too much as yet, but you can see that her lips are beginning to point down into what we call here the marionette lines. The line that I'll be filling here is the nasolabial line, and believe it or not, what happens normally when a patient goes to get a facelift, what the sort of surgeon is doing is actually pulling her face back up into its previous position. You can see this is comparatively painless, and the substance I'm using is hyaluronic acid, which, believe it or not, is a natural sort of substance found in the body.
Yeah.
We get it from bacteria. You get a little sort of redness or swelling after the procedure, but you can see immediately that Sarah's face is beginning to change.
Now, has Sarah been anaesthetized or any sort of painkiller? Or
Yes, just about 3/4 of an hour ago, we put a topical anaesthetic on her face.
Okay.
And usually that's enough. Some patients, particularly smokers, that would have a lot of lines in their upper face.
Right.
Sometimes we have to give a nerve block. Julie, if I can switch sides with you.
You've just done 3 or 4 little injections there. Could you honestly feel anything there? Was that sore at all?
Not very, no, just a tiny little.
A tiny little pinch. Great. Okay. And so, how many injections will you give totally to the face, and what's the desired look?
Just use 2 syringes, and the desired look is really we can see beforehand here. And normally I would sort of have the patient have a mirror. If I sort of pull these lines back up, we'll point the lip back up to its natural position, or at least the position when she was in her 30s. You'll see the result will be quite instant.
How much did this cost, this treatment here?
The substance I'm using is hyaluronic acid. It is the safest.
What, sorry?
Is hyaluronic acid.
Hyaluronic
okay?
acid.
It comes in many forms. We can see here in Restylane, Perylane, Juvederm. The one I'm using is actually a German compound, Matrodex. And
it's all very long. And how much would it cost?
It's usually costs between 350 and 500 euros. It's 350 per syringe. We use this one because it's very biodegradable. It's a natural product made by bacteria, so it doesn't carry any sort of viral strains, the same as collagen could do, coming from cattle with BSE or Hong Kong flu, sort of use avian combs, rooster's combs. So this is replacing the collagen in the body. It lasts a year. Some of the products here, Anna, if we look at them quickly, that one, Bioalchemid, is all the rage at the moment. It lasts forever. It's extractable. We can take it back out again if there's a problem. The big potential problem with fillers is the patient can get what we call a tissue granuloma, that the body turns around and says, listen, I don't want this here.
So I was going to ask you, that's one of the dangers, a rejection, I suppose, of the substance that's going into the face?
Rejection of this is 1 in 5,000, so it's quite rare. Outline, which is the product there in blue, it's more a plasticky type compound. It lasts 5 years. The rejection rate is about 1 in 2,500.
Okay. We'll come...
50 years of the greatest hit singles. Legendary bands with classic songs on one unique album. 42 incredible hits charting 5 decades of music. 50 years of the greatest hit singles. The album.